Welcome to WOW, the Woman of the Week podcast series by Pharma Voice. This episode was made possible by a generous sponsorship from WCG. For more information, visit wcgclinical.com. In this episode, Taryn Grome, editor of Pharma Voice magazine, meets with Karmen Trzupek, director, clinical trial services and rare disease programs at Informed DNA.
Karmen, welcome to the Pharma Voice WOW podcast program.
Thank you. It is such a pleasure to be here.
It's our pleasure to have you. I find your background to be really interesting. I understand you have a degree in genetic counseling. And talk to me about how this experience has influenced your career and what is genetic counseling?
Maybe that's the better place to start. What is genetic counseling? Genetic counseling is really the process of talking with patients and families about their genetic disease, or in some cases a disease that they want to know whether or not may be genetic. It's helping them to navigate clinical genetics, so helping to navigate the process of obtaining an accurate diagnosis, of determining the most appropriate genetic testing, and then interpreting the results of genetic testing, which is getting increasingly more complex, and really providing support to patients and families as they navigate the impact of that disease for their own health and what that risk means to their family members. So I think, for me, so I guess I answered them in backwards order, but for me, when you say, how has that impacted my career, to me, genetic counseling is really the core of what I do. It's my center. Over the years, I've been practicing as a clinical genetic counselor for over 18 years, and in some ways you would say that what I do today is not genetic counseling, but I think genetic counselors have this strong feeling that once a genetic counselor, always a genetic counselor. You're just doing other things with those skills. So, over the years, I've counseled literally thousands of patients, and those conversations are really vulnerable. People really open up about what this disease means to them, what it could mean to them, about their fears and their losses, right? They go through a grief period about what that means for their future in comparison to what they had believed it would mean, or for their child's future. And so I think those kinds of conversations, those experiences really profoundly affect the way I now think about developing and implementing programs in support of clinical trials, because all of it is very patient-focused.
I would have to imagine that those conversations have to be very difficult at times. Where do you find the strength when you have to counsel somebody who's been delivered devastating news about a rare disease?
I think there's hope in almost everything. That's probably the number one answer. For many, many years I specialized in inherited retinal diseases for which there were no meaningful treatments for any of them. So, people didn't die from these diseases, but we'd be talking maybe to a 12-year-old about a disease for which he would likely go completely blind. That's a hard conversation. Or even, a 30-year-old who's looking at the loss of their career that they worked so hard for and they're really just getting started in, and what does this mean if they're no longer going to be able to see? But there's always this hope about maybe being involved in the research and what's happening in the research. There's hope about what they can really do and how they can change their expectations. I think that's part of life. Like, we all have this picture of what our future is going to look like, but you don't know what's going to happen. It's a fine balance, because I don't want to hold out unrealistic hope, but there are ways in everything to try to help people navigate while thinking about, where's the gratitude and how can you find something to work toward.
It takes a really unique person to be able to do that, so kudos to you. And when we look at genetic testing, it's I would imagine, again, come a long way since you started 17 or 18 years ago.
Yeah.
So how has technology helped you in your role?
The primary way technology has changed the field of clinical genetics is when we think about genetic testing. Because, 18 years ago, whenever I was working in clinic and we had patients who we thought might have a particular genetic disease, if we wanted to do genetic testing, first of all, we didn't know a lot of the genes that cause those diseases. So for some diseases, all we could offer them was to participate in research studies to help us try to find the genes. In other cases, maybe we knew some of the genes, but not all. So we would say, well, we know a couple of genes that cause this condition. Let's go ahead and order testing. But the likelihood of finding an answer might be 20%, 10%, right? And that doesn't mean you don't have that disease. It just means we just don't know enough about the genetics of it yet. And today, that's just dramatically flipped. So the good news is that genetic testing has gotten so much better. It's gotten so much cheaper. It has completely changed the way that we can utilize genetic testing to help obtain really accurate diagnoses for patients. But the downside is that we often get so much information back because we've gone from doing maybe genetic testing where we were testing for 2 genes because that's what we knew, to doing testing routinely of like 300 genes at once, and you get back a lot of noise. Frankly, what a lot of people call noise. Like there's just this huge test report with all these variants, and what does that mean? So it's a lot to navigate. So I think that genetic counseling, while the core of it is still about being in those vulnerable moments with patients and families and helping them to navigate that whole process, it has shifted to being a whole lot of genetic variant interpretation and really helping to try to sort of dig into the meaning of genetic test results.
It sounds hugely complicated, and complex. And as you said, there's so much information coming at not only you as a geneticist, but as to the patients. And so how do you kind of break through some of that noise and help focus the communication for patients?
So we might get a test report back, and there could be, say, 6 different genetic variants in the test report. And the laboratory does a really amazing job of filtering out most of the noise because there might be hundreds that they initially look at, but the algorithms will filter most of it out as normal variation. Because there's a ton of normal variation in our genome, way more than we thought there was when the human genome sequence was completed. So the laboratory does some of that, and then we get a test report back, and it's still got a number of these on there. And so part of what we'll do is we'll look at the patient's phenotype, so their clinical diagnosis, their symptoms, and try to determine how likely is it that the variants that were reported in this test report really match the phenotype of this patient, what I see in front of me. Does it match the family history? Because they can be inherited in different ways. So part of it is a little bit of puzzling. Does this puzzle fit together? And then if there is a variant or if there are a couple of variants that seem strongly associated with that patient's disease, we can sometimes provide additional information back to the lab. So it's a collaborative process sometimes that will help them to do further filtering. We can sometimes do additional family member testing that will help to see, how are these genetic variants being inherited in the family, and does that fit with what we would expect for this disease? So sometimes it's easy. Sometimes we get a test report back, and it's like clearly positive, right at the top, very easy answer. Sometimes it's not. It takes time.
Thank you for that. I appreciate that explanation. And as you think about the future, how do you see the role of genetic testing changing in the future? Is it going to be that maybe that silver bullet that could help predict future disease?
I think there's an in-between. I think right now what we're seeing is we are really rapidly approaching a time when genetic testing is no longer just being used for classic genetic diseases. We already see this in cancer. So we see this all the time for tumor profiling. where genetic testing is done on the tumor itself to determine what were the genetic drivers of that tumor, and that's utilized to help guide treatment decisions. This is part of the overall hype about precision medicine. It's hype for a reason. Where treatment is based on the underlying cause of disease, or at least one of the drivers of that disease. We're seeing that, very consistently in cancer, but we're also starting to see that in much more common multifactorial diseases like Parkinson's disease, for example. This is a common adult-onset neurodegenerative disease. Everybody knows what Parkinson's disease is. But there are multiple underlying genetic risk factors where those genetic risk factors in combination with environmental and lifestyle factors are what ultimately lead to the disease. So we're starting to see lots of pharma and small biotech companies developing and testing therapies that are based on that underlying genetic risk, trying to get at not just thinking about treating Parkinson's disease as one big disease, but what's driving that disease. And if there are different drivers for it, let's think about how we can approach treatment in those different avenues, right, those different drivers. So I think that's where it's going in the short term. That's what we're seeing. The longer term, which you got at in your question, is, are we going to get to a point where everybody gets a test, everybody gets whole genome sequencing, and it's going to tell us what we're at risk for and how we should modify our lifestyle? I think we're still a lot further away from that than it seems to a lot of people. We can do the testing, but if right now it's super complicated to dive into the test results from a 300 gene panel, imagine what that's going to be like if you're testing all 22,000 genes and trying to interpret that. We just don't have enough data for the interpretation to do that well.
Fascinating, and agreed. And we also have that human component. Are people going to be willing to know what they're at risk for?
Well, and then beyond what they're willing to know, there's been a lot of really interesting questions and research studies looking at how do people really change behaviors? Do people change behaviors based on something they know they're at risk for if that risk isn't something they're already personally familiar with? So if you have a parent who died young of cancer and you find out that you carry a genetic risk factor that predisposes you to that, will you make different decisions in your medical management? Yes, the vast majority of people will. But if you find out an incidental finding that you're at risk for, say, early onset, cardiomyopathy, and no one in your family has ever gotten that, you don't really know much about it, and you feel really healthy, will you change your medical management? Will you do anything differently? And most of the studies say people don't. So we also have to get to the point where we think about what are we going to do with all of that information, and when people have so much of it, will it actually change behaviors?
Interesting. It's fascinating, and the future is going to be even more interesting and fascinating. It's going to be a whole new. It opens up a whole new world of everything, behavior change, testing, drug development, everything. It's quite interesting. I would imagine that fuels your passion for what you do on a daily basis. And I know you came from an academic medical research center, and then you joined Informed DNA. What drew you to the company?
That's actually easy. Whenever I was working in academia, I was working at a really, really significant clinical research center, and people came to us from like an 8-state radius. It was really an amazing experience to work there and to develop the expertise there in that center. Pardon me, but there were so many patients who never got to our clinic, and it wouldn't be at all uncommon for us to diagnose someone and enroll them in our clinical research studies, and then, that patient might call me later and say, my sister, I think she has the same thing, and I was telling her about my appointment, and she just wants to participate in the research. Can she do that? Yes, of course. Let's make her an appointment. no, she lives in Illinois, right? And, well, no, she has to come to our center, and she has to be evaluated, and we have to do all these tests before she can be part of the research. Well, she can't, right? And this would happen fairly frequently. And so when I came to Informed DNA, here our entire model is, let's take that experience that people have when they go to a large clinical research center and they can get the best genetic testing to determine the diagnosis, and they can enroll in research, and they can learn about what's going on in clinical trials, all of that. Let's deliver that on a telemedicine model to break down these economic and logistical barriers that people have, because so many people cannot just get on an airplane and fly across the country to get to, the best clinical research centers, and we shouldn't be delivering that care only to the people who can.
Amen. Absolutely.
So thanks.
Yeah, I couldn't agree with you more, and for a variety of reasons, right? So tell me, how are you looking to break down those geographic and economic barriers? What are some of the things you all are doing?
You can tell. Yeah, you can tell I'm totally passionate about this.
I love it.
I am. I think, not only can we do better in diagnosing patients who aren't able to travel to those large academic medical centers, but we can also do better in inviting them to participate in clinical research and inviting them to participate in clinical trials. So a lot of what I do comes down to this. So how are we doing that? Well, we make genetic counseling appointments available to people utilizing telemedicine, right? We have EMR systems available today where you don't need to be physically on site at an academic research center in order to be in an EMR, right, an electronic medical record. That's just unnecessary. So we deliver that over telemedicine. We order genetic testing, remotely. We have labs, these very specialty genetic testing labs, send test kits out to people's homes. And this isn't like direct-to-consumer genetic testing. We're helping to determine what is the best test for this patient, what is most appropriate. But then when we order it, we're getting it shipped directly to their home. And then once we get the results and we interpret that and we provide that information to the patient and family, we're also, throughout that whole process, we are partnering with community physicians, because those community physicians, don't have the expertise to know what is the best genetic test for this patient today, which might be totally different than it was 2 years ago, and I can't keep up with that. And they don't have the luxury of time that thankfully genetic counselors do get. They don't have that luxury of time to sit down and research those genetic variants and then sit with the patient and their family to discuss those findings. So we partner with those community physicians to say, you can incorporate this into your medical practice, and we'll be your partner, right? Because we know that you want to help patients get better diagnoses. We know that you want to screen your patients for these clinical trials, but you don't have the infrastructure in your own clinic to do it. So let's partner together. And then I think the final piece of all of that is that we can, by doing all of that, really implement remote clinical trial screening. There are so many clinical trials that fail due to insufficient patient enrollment. This is a huge, huge problem for the entire pharma and biotech industry. But, I think it's an even bigger issue for patients, because when I think about all the work that I've done over the years with patients with rare diseases, any clinical trial that fails due to any other reason than a lack of efficacy is a total loss to the patient community, and it's a real failure. So let's not do that, right? Let's screen patients in their home communities, sometimes right in their own home, and then we can really talk to them about how could we support you as a clinical trial participant if that's something you wanted to do. What would that take? Where could you travel to given the support? How frequently could you do that? What would we need to implement closer to home to help you to be part of this?
That's excellent. And it would, obviously solve, as you said, one of the biggest problems in clinical trials, and that's patient recruitment and patient retention. And as we look at the dearth of investigators that is predicted to be in the future, we really need to start to think about some telehealth and some other ways in which to support clinical trials for the benefit of everybody, as you said. So this is exciting. Congratulations.
Thanks.
Let's switch tracks a little bit, and let's talk about you as a leader. I understand that you serve on a couple of boards. I'd love to hear what that experience is like for you, and tell me why board service is important to you.
I do. I serve on 2 different boards, both related to a rare disease called Usher syndrome. Usher syndrome is the leading cause of combined deaf-blindness in the Western world. So many years ago now, gosh, I would say like 13, 14 years ago maybe, I was in clinic working as a genetic counselor, and we had a family come to us, and we diagnosed their son with Usher syndrome. He was born deaf. He had cochlear implants at the time that we saw him and was starting to lose his vision. This is a devastating diagnosis. And that family left that day and told me later that after lots of crying, they pulled it together and decided that they needed to do something. They just really desperately needed to do something. And after doing a little research, they decided to start a foundation to raise money and awareness to try to help fund treatments, research toward treatments. And I helped them and, just volunteered with them for a while. And then eventually they asked me to join their board. And then I've served on that board for now probably the last 12 years. And then at some point, a few years into that, and that's a local organization. It's called the Hear, See, Hope organization in Seattle, which is where I live. And then a few years into that experience, the Usher Syndrome Coalition was born. That organization is a national organization that really works to try to provide kind of a single home for patients and families affected by Usher syndrome. So sort of a one place to go and get support information, but also they work really, really hard to try to ensure that researchers are actually talking to each other and sharing data and thinking about what is the roadmap toward meaningful therapies and how can we ensure that we have people doing different parts of it and not overlapping and doing all the same things. So this can be difficult to manage, but they've done a great job with it. So I started serving on their board as well because they asked me to come on board and do that, and it's been a really rewarding experience.
I think it's wonderful that you are serving for organizations that are so dedicated to these underserved patient populations, specifically this one, Usher's disease. And it is so devastating, and I have to say I had not heard of it before, so thank you for sharing information about this. And I find it so fascinating that so many of these rare disease organizations spring up from grief, as you say, grief and then into hope. Because at the end of the day, what else can these parents do, right? They need to do something, and this is their way of doing something. So your support is very admirable.
I think most people who get into this field are very passionate about it. They believe in it strongly. So, here at Informed DNA, I have other colleagues who serve on boards as well, and they didn't go out searching for a board position. They just, said, hey, for the last 3 years, I participated in the, Susan Komen Walk for Breast Cancer, right? But there's a local organization that's doing some work as well, and, maybe I'll just volunteer locally for them. And then one thing leads to another, and they end up serving on their board because that board realizes, that organization realizes, having a genetic counselor experience, that perspective on our board would be really valuable. And so it's pretty organic, but I think anybody who's interested in serving on a board, it just usually starts from offering to help, really.
Thank you. That's great advice. I know so many of our listeners are looking for ways to pay it forward, to provide service, and give back based on their career experiences. And it's hard let's face it, it's hard to get onto a board, especially on a big public board. So one of the ways to, get your feet wet is through a local board where they have an affinity or a passion for it, because I think it makes it easier also.
Absolutely. And the smaller ones often really need help. And so having that perspective, having that help, I've told my kids who have, my teenagers who have these volunteer requirements, make sure that what you're doing when you're volunteering is something that you're passionate about, but it's also something that fills a need. Don't go out and volunteer to check a box on a form, right? Make sure it actually fulfills a need. So ask what they need. Don't say, this is what I'm going to do for you.
Also great advice. Thank you. Talk to me about how you lead your teams. How do you lead? How would you describe your leadership style?
I guess I hope that the members of my team would say that I am a leader who looks for the strengths in others. I think that's certainly what I try to do. Some of the genetic counselors, and I'm going to speak mostly about genetic counselors because Informed DNA is a company that is built on genetic counselors. I don't know, I might get in trouble for throwing out this number, but I'm going to guess that like 75% of our workforce is genetic counselors who do a variety of jobs. They don't all do clinical genetic counseling. But most of my experience as a leader has been in leading groups of genetic counselors, so I'll speak from that. But, some of the genetic counselors I've worked with are clearly natural leaders, so I try to find opportunities to help them to develop and use those skills. But not everyone was meant to lead. That's clear. So I really try to look for other strengths and other interests because, ultimately I want every one of them to feel fulfilled. I want them to stay with us, so I want them to feel like this is a place that listens to who I am, what are my interests. I recently promoted someone to work with me who's incredibly detail-oriented, so much more so than I am, which is such a great balance to me and to my own strengths. But I very much talked to her about that when I hired her, when I promoted her on this team, that was a huge part of why I chose her and promoted her and wanted to ensure that she agreed with that strength and that's something that she actually enjoys doing, because I'm going to end up giving her a bunch of tasks that are very detail-oriented, and she loves it. Hallelujah. So, yeah, hallelujah. And, it's probably worth pointing out that some of our genetic counselors here are amazing counselors. And we're so lucky to have them doing exactly that. And they're not looking to do anything different, right? They love being in those vulnerable moments with patients and doing that work. And so it's important to recognize that too.
Talking about those individuals who have to work with patients in those vulnerable moments, and as I alluded to earlier, it really takes a special kind of person to be able to do that work. How do you keep your teams inspired and motivated when often they're dealing with really difficult conversations? And it could become, I would think, quite weighty on someone.
It can become weighty on someone, and I think over time there is a little bit of compassion fatigue that happens to some people. And I don't mean that like they stop caring. Of course.
No, of course not.
But it's like, no, of course not. But you get, there are some people who get to a point like, wow, this is just really hard to continue to do, right, day after day. And so those are the people who we try to look for other opportunities and, ways for them to grow and develop other skills. But I think for the genetic counselors who genuinely love what they're doing but do still get sometimes a little weighted down by the difficulty of some of those conversations and by just the weight of what this means for patients and families, I think the number one thing that I probably can do to help inspire and motivate them is just help them to realize how much we are making a difference. That we are helping people through these really difficult times, and we get patient feedback that's just, it's amazing. I've said before, it's like a drug. Like, to hear people say so frequently, oh my gosh, that was just incredibly helpful to me at a really difficult time in my life. Thank you for what you do. But then beyond that, on the kind of bigger picture, beyond one family, beyond one patient, I try to help them to remember, our team, I try to help them remember, like, what we're doing, we're enrolling more patients in clinical trials, right? That's leading to therapies. We were we have been really integrally involved in helping to support clinical trial screening for programs that have led to FDA-approved therapies that have completely changed the landscape for patients with multiple different rare genetic diseases. That's incredible. So it's pretty great to have both, to have the perspective of what you're doing on an individual patient basis, but then on a bigger picture scale.
That's awesome. And so how do you measure those successes? Because that has to feel great when you're able to change a disease paradigm. That's incredibly intoxicating, I would think.
It is. I mean, I can't really measure what we do based on whether or not a drug gets approved, right? So that's pretty far out of my control. But I think when I came to Inform DNA, it was really with a singular purpose, which was to deliver that same level of specialty care, right, that I did previously at an academic research clinic here on a telemedicine model. And I think, 10 years later, when I'm here directing clinical trial services, I think that purpose still guides me, and it really still guides our success. So, I guess what I'm saying is, in everything that we do, are we increasing access to care? Right? Because of our programs, are more patients accessing and understanding genetic testing? Are more patients with rare diseases choosing to participate in clinical research because the studies have become more available to them? So if the answers to those questions are yes, I think we're succeeding.
Fantastic. Now, if you had to go back in the Wayback Machine and think about a piece of advice that you would give to your younger self, what would that be?
I think embrace change. I actually loved my job in academia. The only reason I left was that my family and I moved. So when I worked in an academic medical institution that was in Portland, and we moved to Seattle, so I couldn't, quite continue working for them for very long. That wasn't going to work. And saying yes to this job at Inform DNA, that was not an obvious choice. At that time, Inform DNA was very small, really just getting their feet wet, and I was not at all sure this company would be successful. But I believed in the mission, and I was really impressed with the people, so I thought, well, I'll give it a year, right? I'll just see. I'll give it a year. That was 10 years ago. Today, Inform DNA is the nation's largest provider of genetic counseling and genetics benefit management services. I never would have dreamed that would happen. And if my family and I hadn't moved for other reasons, I never would have had that experience and all of the roles and experiences that have happened as a result of that. So I just think there's so much to be gained by just embracing change.
Love it. Can you identify one wow moment in your career that either changed the trajectory of your career or provided you with a lasting impression?
Yeah, this is actually another really easy one for me to answer. You might think it's going to be a patient story, and it's not a singular patient story. I have so many of those, but for me, so I had this incredible opportunity in the fall of 2017, so a couple of years ago. I was invited to serve as an expert responder for Spark Therapeutics' presentation to the FDA advisory panel when they were going to review their data on gene therapy for RPE65-related retinal dystrophy. And that was such an honor. It was a really cool thing to be part of. And so I was there, listening to Kathy High and others at Spark present their clinical trial data and listening to the FDA's response. And then in the afternoon, patients and families got up and spoke about their experience and how this gene therapy had completely changed their lives. It was so incredibly emotional. It was really emotional. And then at the end of the day, this was a whole day-long experience. At the end of the day, the advisory panel voted. Right there in front of us, they voted 16-0 in favor of approval. And that represented the first gene therapy for any genetic disease in history that went on to get approval by the FDA. And I got to be there. That was pretty awesome.
So cool. I had chills. That's a whole whoop whoop moment, right?
Yeah. And after so many years, of being in that room, diagnosing patients, talking to families where there's nothing, no treatment. And there's not nothing we can do. I think I've convinced you of that. But there's no meaningful treatment. And then to have the first one, and it's like, here we go. We are going to treat these diseases.
That's fantastic. Thank you so much for sharing that. That's great. What a great story. Karmen, it has been such next in terms of genetic testing and the progress you make in making sure that more patients get enrolled in clinical trials so that we can develop better medicines to treat these rare diseases. So thank you so much for your passion and your dedication to the industry.
Thank you so much. It was great to be here.
Thank you for listening to this episode of WOW, the Woman of the Week podcast series. And thanks again to WCG for sponsoring this episode. For more information, visit WCGclinical.com. And don't forget to check out our other episodes at pharmavoice.com/wow. This 2020 program is copyrighted by PharmaLinks LLC.